Today we're taking the time to gather people from all over the country with expertise in a whole host of different arenas to talk about what is patient-centered cancer care.
One of the great benefits about bringing all these different people together is hearing from so many different perspectives and learning from so many different people.
I advocate on behalf of patients.
I'm the senior vice president of a nonprofit.
I'm a researcher.
I'm a 26-year survivor of Hodgkin's disease.
The types of people that we have at this event all have a stake or an ability to influence patient-centered cancer care.
I'm excited because we're going to talk about the challenges, but we're also going to talk about solutions. So I hope that everybody will join and actively participate in a way that opens our vision to what could be.
What we want to do in this meeting is come out with an agenda and actions and things that we can do that are actually going to make a change.
This notion of care that is responsive to and respectful of the needs, values, and preferences of patients.
The opportunity for incentives to align as powerfully as they are right now has really never existed in the past. It's about changing the way that people interact in the healthcare system.
I think that if the patient was reliably and sustainably at the center of cancer care right now today, that we probably wouldn't have all gathered to have this meeting.
I think that there's a big challenge in taking an existing system and trying to transform it into something else.
What we've tried to do here is really create a collaborative opportunity for dialogue and working together.
One of the questions is around whether or not there's such a thing as too much information.
Do they want to know everything, or does somebody in their family want to know everything? And so that you understand what the scope of communication will be right from the start.
How they interact with their family is probably how they want to interact with their medical team.
During the roundtable discussion, we were asked to think about different possible solutions for improving patient-centered care, and so we talked about some interesting ideas.
In our particular table, we had a patient. She's going through treatment right now, and what changes we can implement to make the care better for her.
There's no really good way of your specialist who has no relation to your oncologist, who has no relation to your therapist, nobody's talking. And that's because we don't have systems in place.
Let's talk about each of the elements that you have chosen and why is it hard to deliver coordinated integrated care?
I think it's because we're not a team with the same goals.
I think we need to broaden this picture out. We need more providers and more team members to sit with patients to understand what their true needs are. We just don't fund it, so we need to build better funding systems.
The most moving thing today was to hear from patients themselves.
We have to have their voice because they're the ones who have the experiences to share with us, both good and bad.
I learned very quickly that we really cannot do cancer alone. We need our people. Medicine killed my cancer, the people gave me life.
The cancer that I have, diffuse astrocytoma, that's a completely random draw that I had no say in. That didn't have to be true about the doctors.
We timed chemo so that Ruben wouldn't feel sick at our wedding. Dr. Hoverman built the treatment plan around the person. He spoke Ruben's language. That's patient-centered care.
Whenever I have an opportunity to hear patients' experiences, it reinforces my notion that those experiences ought to be part of the educational experiences for physicians. I don't think physicians often hear the kind of panel that we heard today.
I think Livestrong is an amazing collaborator and a unifier, and I think they're not afraid to think big and to ask hard questions and then to put the right people in the same room.
Whereas there's some opportunity to help patients feel more in control.
Practitioners need to understand the importance of their patients having information.
They're pulling people from every aspect of the issue and providing the opportunity to have those conversations. It's just such a unique environment where I think everyone can feel heard.
Ultimately, the goal today was to define what the future could look like. We heard a lot from a very diverse group of people, and we started to get into the solutions and what actions we could take to improve the lives of millions of people.
The ultimate outcome of building a model of patient-centered cancer care is to put the focus back on people and families. It's person-centered medicine.
We have to create an ecosystem in which we can really push these things forward. There's so much innovation already going on in cancer, and particularly in Austin, that if we didn't embrace that and help to move it forward, it would be a huge lost opportunity.
What I'll take away from this event is a renewed and clearer definition of how patient-centered care can be actively implemented in a cancer environment.
I absolutely believe that partnerships and new relationships will come out of this experience.
I think what I'm really excited about is knowing that people are going to leave here and go back and do something a little bit differently, feeling inspired by a story that they heard or a conversation that they had. And people are going to feel supported and know that there is a community behind them, and we want to be here with them as they work on these changes.